Hi, welcome to my channel. So I'm going to talk about selected opportunistic infection in HIV and AIDS and their management, including causes. So we're starting with what we call pneumocystic pneumonia caused by this fungi called known as pneumocystic girovic. Pneumocystic girovic. Yeah. So symptoms usually is fever, that is high body temperature, non-productive cough, shortness of breath. So management, first of all, management is divided into two. So we have what we call prophylactic, which is prophylaxis. So those who are at high risk of developing this are given prophylactic management. So usually they give what is called the trimethoprim sulfamethoxazole, which is common known as Septrin. So trimethoprim sulfamethoxazole combine, is a fixed dose, or is a combination of two drugs, trimethoprim plus sulfamethoxazole, and then usually they give 960 milligram once daily for those 12 years and above. So when it comes to management, the drug of choice is 2 trimethoprim sulfamethoxazole Septrin, and then the dose is usually they may give 15 to 20 milligram per kg per day. That is for trimethoprim. And then for sulfamethoxazole, 75 to 80 milligram per kg IV orally in divided doses every 6 to 8 hours for 21 days. So this is the total daily dose, and then you divide it. You can give maybe 3 times IV, but orally usually they give every 12 hours. But for treatment in severe cases they may give it even 4 times. So let's chew on pneumocystic pneumonia. So if a patient can't take Septrin, trimethoprim, corticosteroid, you can give an alternative, which is pentamidine. So pentamidine can be given as 4 milligram per kg IV daily for 21 days. There's also called adjunctive therapy, so maybe supportive therapy. So they give corticosteroids such as prednisolone. So they can give 40 milligram. They give 40 milligram BD per oral for 5 days, and then they reduce to 40 milligram OD per oral for 5 days. And then they temper to 20 milligram once daily per oral until completion of the therapy. So we talk about for 11 days and above, depending on the response. So the reason is just there's usually inflammation in the lungs, and also the reason for tempering the dose of this corticosteroid is basically to prevent suppression of anterior pituitary adrenal axis. Yes, so that's where they temper. So we're going to the second common infection is toxoplasmosis. Toxoplasmosis is caused by Toxoplasma gondii. Toxoplasma gondii. Yep. So treatment is basically first line. You can give pyrimethamine. 200 milligram per oral once, then you start giving 50 to 75 milligram orally daily. And you can add what we call sulfadiazine. You can give 1 to 1.5 gram orally, QID. And also you can add the leucovorin 10 to 25 orally, basically to prevent the side effect which can be caused by sulfadiazine. So this one is given. Yes. And then alternatively you can give clindamycin 600 milligram orally or IV QID. Yes. So we're moving to the third one, which is called the cytomegalovirus, CMV. To affect the eyes. So the cause is caused by cytomegalovirus. So treatment, you can give first line as ganciclovir or valganciclovir. So dosage ganciclovir can be given as 5 milligram per kg IV. BD or BD for 14 to 21 days. Yes. Then then 5 milligram per kg IV daily. And then Valganciclovir can be given as 100 milligram orally BD for 21 days. Then 100 milligram once daily until improvement. And then what is the alternative? You can give, so this is a viral infection, they're giving antivirals, Foscarnet. So 90 milligram per kg IV BD, or 60 milligram per kg IV TDS for 14 to 21 days. Then 90 to 120 milligram per kg IV daily. So the first one we're looking is cryptococcal meningitis. So cryptococcal meningitis is caused by Cryptococcus neoformans, caused by Cryptococcus neoformans. And then a treatment has got 3 phases. So got 3 phases. Phase 1 is called the induction phase. So you can give amphotericin B. Dosage. So amphotericin B, it comes in different forms. So if you're using amphotericin B, the oxychoretin, so you can give 0.7 to 1 milligram per kg IV daily. And then plus C for cytosine, plus cytosine 13.5 milligram per kg orally four times daily for 2 weeks, that is 14 days. Alternatively, I've seen under induction, sometimes they give amphotericin B plus fluconazole. They can give between 800 milligram to 1,200 milligram. So for 14 days. This combination or this, but this one is the most effective effective. Yes. So the second phase is called consolidation therapy. Consolidation phase. Consolidation phase. So we have what we call fluconazole. Fluconazole is it falls under others. Fluconazole. So usually they prefer giving 400 milligram once daily per holo for 8 weeks. Yes, and then in last phase is called the maintenance therapy. You can still give fluconazole 200 milligram once daily. Once daily until there is immune reconstruction. Until there is immune reconstruction. Sometimes the other teacher they say for 6 months, but the latest information is until there is immune reconstruction, until the immune system has reconstructed, has become strong. Yes. And then the first one we're going to talk about is mycobacterium complex. Yep. Known as MAC. So this is called by Mycobacterium avium intracelluli. Called by Mycobacterium avium intracelluli. So treatment. So first line, we have clarithromycin. Clarithromycin is a macrolide or azithromycin, and then you combine with ethambutol. So dosage, clarithromycin can be given as 500 milligram. BD per oral, or azithromycin can be given as 500 milligram to 600 milligram once daily per oral. Also, they may add rifabutin sometimes. Rifabutin, they can give 300 milligram orally. Yes, per oral. This is usually in severe cases. Yes. So we're moving to the 6-1 TB, tuberculosis. So caused by Mycobacterium tuberculosis. So first line, about 4-FDC, which is a fixed dose combination. So we have what we call, there are 4 drugs. There's rifampicin, isoniazid, pyrazinamide, and then ethambutol. Yes. So isoniazid is given as 300 milligram orally. Yes. So then rifampicin 600 milligram orally, and then parazinamide can be given as 15 to 20 milligram per kg daily. So yep, so for 2 months. Same with this for 2 months. So this, they call it induction therapy, induction phase, I think, or initiation phase. You give 4 drugs. You give 4. So and then ethambutol, and then yep, and then after 2 months you continue with the rifampicin and the isoniazid. Yes, for 6 months. We're talking about so the duration for that for TB in HIV patient, they say treat up to above 6 months. They say you can treat up to 12 months, 1 year. Others 8 months. Yes, but the TB has to be above the normal 6 months. So 712 Kaposi sarcoma. Yes, so sarcoma is caused by human herpes virus 8. Yes, so how do you treat it? So give ARVs to control HIV. So for your country guideline, yep. So you can start with the AZT, because this is if someone presents with sarcoma and he has never taken HIV, you can proceed to second line AZT plus 3TC, maybe plus DTG, or maybe you can add Opinava, Ritonava. Yes, and then there's what we call, you can also give local therapy, radiation, and then you can give what we call systemic chemotherapy. So you can give doxorubicin. So they say liposomal doxorubicin or paclitaxel So doxorubicin can be given as 20 milligram per meter squared IV every 2 to 3 weeks. So every 3 weeks we give. And then for paclitaxel, 10 milligram per meter cube every 2 weeks. Yes. And the other very commonly can say herpes simplex virus. For treatment, you can give acyclovir. Yep, so acyclovir 400 milligram. TDS or 200 milligram 5 times. Yep. Or you can give cyclovir. You can give 1 gram already, 1 gram per oral. BD, yes. And then you can also what we give for chronic suppression therapy. You can give a cycle of 400 milligram BD or varicyclovir. Can give 500 milligram daily. Simple as well. So there's also oral candidiasis. So nice one, candidiasis. Common is oral in the esophageal. So for oral, you can start with nystatin. 100,000 international. I think you can start with in adult even 400,000 international units QID, and then you can add the fluconazole 200 milligram, so 200 milligram for 14 days. And then for esophageal fluconazole as well. So you can give fluconazole 200 to 400 milligram per oral once a day for 14 to 21 days. Or you can give itraconazole 200 milligram all day for 21 days. Yep. Thank you so much, guys. These are examples of common and concerning opportunistic infections. Thank you much. Follow me, subscribe to my channel, tutorials Abraham. Please subscribe for more videos. Yes, thank you so much.